Spot On is supported by the Boston University Sargent College's Master of Science degree in Nutrition program. Log on to bu.edu to learn more about this fabulous nutrition graduate program. You are listening to Spot On, a health and wellness podcast that breaks through the latest media headlines to provide you with accurate and usable information that is, well, spot on to meet your needs. I am your host, Dr. Joan Salge Blake, a nutrition professor at Boston University and the author of the college textbook called Nutrition and You, which is used in colleges across the United States and abroad. Hi, I'm so excited today to have this episode on Spot On, and let me tell you, it's a very crowded podcast studio because today's episode is about therapy dogs, and I have a therapy dog in the studio, and it's human. That's what I like to call it, because really the dog is everything. The human just brings it around. But this therapy dog is a Bernese mountain dog, and we're going to have to add on to the podcast studio because this dog is not a lap dog unless your lap is about the size of a couch, because this dog weighs about over 100 pounds. It is a stuffed animal. Hashtag stuffed animal. That's what we're going to talk about the whole time. Let's go to the street and find out what folks think about having therapy dogs at campuses and at the workplace.
I really love therapy dogs just because they can make me feel so much better, especially during stressful times such as midterms and finals.
Okay, I really like therapy dogs. I think that they're really useful in relieving stress and anxiety that people feel, because it's nice to hug them and kind of release all of your negative emotions.
Offer us a kind of cuteness in campus, and we're quite nice and we're quite relaxing.
Therapy dogs are beneficial to somebody, especially depression is a thing and across American universities.
I do have a friend, she likes dog very much, and she thinks it really helps, and she likes the dogs in school.
I think it's good because I've never had one, but I've seen one in my classroom.
I feel like there should be designated areas and time frames for the therapy dog to be in a workplace specifically, just because that if the dog is often around, it might be a little bit distracting for the workers. It might bring a negative effect for the therapy dog.
On campus, students are always stressed out about schoolwork. When we are interacting with dogs, they bring us happiness, and then we can relax with them.
As long as the dog isn't really bothering the passerbys and general people. Depends on the location.
I'm so excited today to have on the show this fabulous therapy dog, Otis, and his owner or human, I don't know what, she's the mother here. It's Cara Guenthur, and she's actually in her 4th year of medical school here at the Boston University School of Medicine. And this is really a fascinating story about, not only how therapy dogs work and how much good they can bring, but how she met this therapy dog and how it all came back. So with that introduction, I want to welcome Cara to the program. And I'd also like to welcome Otis. And if you hear some heavy breathing, that's Otis, okay? So just, we're going to work with everybody in the studio right now. So again, thank you for coming on Spot On.
Thank you for having us. It's really exciting to be here.
It is exciting. So tell me, what made you decide you want to be a doctor?
Yeah, that's a good question. There were actually kind of a lot of reasons that changed over the years. I think I've kind of always wanted to be a doctor, quite honestly. I can think back to when I was a kid, I used to hoard Band-Aids, and I always wanted to be the one that put them on my siblings when they got hurt. And then recently
Did you want to rip them off too?
No, that part I actually did not like because they would inevitably cry. But I just was always fascinated by cuts and bruises and things like that. And then as twisted as that sounds. And then I was recently looking through some of my childhood things that I had in storage, and all the books that I saved had to do with kids going to the doctor or getting their teeth pulled or just having broken bones and things like that. So
isn't that interesting?
Yeah.
That is great.
Took me by surprise. I didn't really realize that until recently. And then as I got older, I just kind of realized I liked being the person that people went to when they needed help. And I realized that I liked the math and science courses, but specifically biology.
Right. So this is a match made in heaven.
Yeah, I think so. I mean, so far it's been great. Right. I wouldn't change it.
So how did you get this idea to get a therapy dog? My friend Otis here.
Yeah. So, I kind of saw myself get really excited when I saw other therapy dogs on campus. And I saw how much joy they brought to other people as well. And then I would come home and I'd have this dog that was so loving and just wanted to sit on my lap the whole time. And to the point where it was hard to do work when I was home because he just needed so much comfort and so much attention. And I also found myself craving more patient interactions because in the first 2 years of medical school, you have so much that you need to learn. So much of your teaching has to be classroom-based. And BU actually does a great job. You have this Introduction to Clinical Medicine course that runs through your first 2 years. So you actually do get to interview patients and take histories and do physical exams, but it's just not enough.
Right.
It's not as much as you would have as a third or fourth year medical student or as much as you would have in your career. And so then I thought, well, why don't I train Otis to be a therapy dog, given his temperament, and through that, try to bring a little bit more joy to patients' lives and also get to have more patient interactions.
Right. And is it a hard process to go through to become a therapy dog?
So surprisingly, no. Because really all that they have to be able to do is kind of the basic obedience skills, like sit, don't eat stuff off the floor, don't jump on people, things like that. And then after that, it's just temperament-based.
Right.
So for instance, my other dog, Ellie, is not cuddly. So while she's super obedient and she would sit next to a patient and she would endure the petting because she's just such a sweet dog, she would have her sad ears the whole time.
Oh.
So it really just comes down to their temperament. So once you do your basic canine good citizen training that tells you or the therapy organization that your dog can sit on command and can walk on a leash and things like that, I went through this organization called Dog Bones that just...
Oh, yes, I've heard about this.
Have you? Yeah, they're wonderful. They're based in Massachusetts. They certify you nationally, and they have 2 or 3 hour sessions. They put you through different medical scenarios to make sure your dog is okay with wheelchairs. One dog actually failed because she was a golden retriever and she couldn't get over the tennis balls on the bottom of a walker.
Yeah.
So she just kept diving at the walker, which of course
that's
a therapy dog can do.
Yeah, it's hysterical. You know, tennis balls are just a magnet for dogs.
Exactly.
You know, I mean, therapy or not.
Exactly.
Right? Oh my God, that's a riot.
Yeah.
So Otis passed, obviously, with flying colors.
Yes, he did. I was so proud of him. I was so nervous, but so proud of him.
So let me tell you about the backstory of how I knew Cara and of my good friend Otis here. So every year, or every semester, I should say, during exam times, which is such a ridiculously stressful time for college students, any students, in December and, of course, again in May, I would bring in therapy dogs when they're studying for the exams. And I just want to put out there right now, I'm a professor here at Boston University, but I hate giving exams, okay? I want you to understand that. I don't do it because, this is you're a crazy person. I hate giving exams, and I know you hate taking exams, but I have to do it, okay? So you're really stressed, so I got this idea to bring in therapy dogs, the week when the students are studying for these exams and they're really, really high peak stress. So we found Cara, we found her, and we found Otis. And I'm telling you, when Otis walks in the building, it's like a magnet, because the people come from out of the woodwork, and as soon as they see Otis, they want to be petting them. And what I found after many years of doing this was that we would put an Otis or Otis's friends, I have many therapy dogs in one session, in a circle, and the students would be surrounding Otis, and let me tell you that's a big circle because Otis is huge, and they would be petting the dog, petting up and down, and the students are not even understanding what they're saying, and all they are saying, I miss my pets, I miss my pets, I miss my dog, I miss my cat. I have been doing this for about 4 years, and I'm telling you, they have never said, I miss my mother, I miss my father. They never say that. They never miss them. They miss their animals. And so talk about that, because when you think about that, they pack up, but they miss their animals.
I know the bond between humans and animals is just so strong and so remarkable. And for dogs specifically, I mean, it dates back like thousands of years. We just have this rich history of relying on and being protected by dogs. And they just, I think that because it's so obvious to see that they're so happy to see you and how much joy and relief you bring them and not just them to you, it just creates this wonderful relationship where that's just purely joy-based and based in love.
You know, with all the wonderful attributes that having a therapy dog can do for you, whether you're stressed or even in a good mood, try to seek out to see if your campus has a therapy dog. Oftentimes they may be in the student health center. That'd probably be a great place to start. So, like, when you walk in the door and Otis sees you, like, what happens?
Oh, well, this is not therapy-approved behavior, but he jumps on me, for sure.
All right, let's keep that between us, all right? That stays between us and the spot-on listeners, okay? We don't want him to get demoted because he's too darn cute to get demoted. That's great.
So he jumps, and then he'll run and get a toy, and then he'll just want to play.
That's fabulous. He's
really sweet.
Now, I saw that Otis has a ID card for the hospital with his picture on it, and I have to say it's a very nice picture, by the way. It's got his left side. Yeah. So, tell me, does he go to school or work with you?
Yeah, so he does. Less so in my 3rd and 4th year of medical school, just because I have more of the hours that a doctor or a nurse might have.
Okay, sure.
So it's a little bit harder. But he does. We do both student therapy at the School of Medicine. We try to host them on a weekly basis, and it's either we'll go or another member of BMC's Healing Pups will go with his or her dog, and it's wonderful. And then we also go and see patients. He and I do.
Right. So actually you're doing for the medical students, the students in the School of Medicine, the same thing that I'm doing here for undergraduates. So you're right. I mean, that's all. A medical school, any kind of graduate program is stressful too. So that's so fabulous that every week the students can come and visit.
Yeah, it's about every week. It's hard because we rely on the schedule of providers and other healthcare professionals with their dogs.
Right.
And so sometimes, things happen and they have to cancel or their schedules are just too busy. But yeah, we try to aim for once a week, particularly on reading days, which are the days before exams.
Same thing. So you're the same thing.
Exactly.
We have two great minds here.
Yeah.
So how is he with the patients?
He's really good with them. So we try to go see the pediatrics floor because I want to go into pediatrics. So those are patients that are really near and dear to my heart. I would say about 50% of them are terrified of Otis because of his size.
Yeah. I just want to tell you that we will put plenty of photos of Otis. Maybe one of you, Karen.
I don't have to be okay.
But plenty of Otis up on the Facebook page, because when you see the size of this dog, you could almost see why the kids are a little bit hesitant at first. But I can imagine once they start petting this dog, this is like butter.
Yeah. I mean, the nice thing about his size, too, the flip side of that is that there's so much of him to pet. So I can hold his head close to my end of the body, and a child can pet his tail or his hind legs and still be a good distance away from his head and feel comfortable. Right. And then slowly you see the child start to inch closer to the head, and then oftentimes by the end they're like lying down next to Otis or they're getting kisses from Otis. It's really sweet.
That's really good. And you can just see that apprehension, and they just bring some joy.
Yeah.
So tell me the difference of this, because I did some reading, and there's things called service dogs, there's like emotional support dogs, and then we have my Otis therapy dog. So what's a service animal?
Yeah, so a service animal is trained specifically to provide a skill set to someone with a disability. Right. So those dogs are often trained from birth, essentially. Okay. And so that would be like your seeing eye dog, for example, or a seizure alert dog. BMC has a great dog sergeant who's a seizure alert dog.
Which is amazing.
Yeah.
So do you want to explain what that is to the listeners?
Yeah, so what I believe, and I hope I'm characterizing this correctly, but I believe what Sergeant does is he is trained in the signs of a seizure, and he barks loudly when a patient has a seizure so that the parents can come. He works with kids,
Right.
so that the parents can come and help the child through the seizure.
Totally amazing.
Yeah.
Totally amazing, the bond that goes there.
Absolutely.
And then what is the emotional support animal?
So an emotional support animal provides comfort and emotional support
Right.
to the owner.
Okay.
So whereas Otis is a therapy dog and provides comfort and affection to others,
Right.
an emotional support dog is for the owner.
Right. I have read so much about how these therapy dogs can affect you physically and emotionally. So what do you know about this physically? What can they do?
Yeah, so studies have shown that therapy animals lower heart rate, they lower blood pressure, they decrease cortisol, which is one of the hormones associated with stress states. They increase oxytocin, which is a hormone involved in bonding, dopamine, which is a pleasure hormone, endorphins. So there are real, actual physical effects associated with animals. Beyond that, they've been shown to lower like depression rates in elderly in homes. They've been shown to help. So anyone going through physical therapy, it's really annoying doing repetitive motion, but people, as you said, will pet an animal for 30 minutes, an hour at a time, and in that they're working their rotator cuff or whatever muscle they might have torn.
You know, that's so interesting, Cara. They just said that because my son, who when he hated the dentist. I mean, hated the dentist. And this dentist had these 5 little dogs. And this was 100 years ago. So the reason why he had these dogs, and he didn't realize it was therapy dogs, but at the moment he didn't realize it, is one day his wife had to go to work. She was a doctor also. And so he had to take the dogs to the dental practice, right? So he took the dogs to the dental practice, and it was a pediatric dental practice. And the dogs came in, and the dogs would jump up on the kid's laps in the chair, and they'd pet him. And he noticed, like he could see the stress level come right down. And then he took them every week, you know. And I would only make an appointment when the dogs were there. And look, I could care less about the dentist. I would say, when are the dogs coming? Because I'm not bringing my son unless the dogs are there. You know, and it is just remarkable how this works.
No, and you touch upon an important thing. They're a distraction, right? They distract the patient or the person from the stressful stimulus. They remind them of life outside of the dentist chairs, outside of the hospital. They, just like with the kids, they're reminded of the students here at BU, they're reminded of their dogs back at home. It just kind of pulls them out of whatever stressor is in their life.
That's right.
And same with healthcare providers. I mean, the burnout rate in medicine is so high, and while Otis does not by any means address the systematic problems that are leading to that burnout rate, he provides a moment of relief and of refocusing and hopefully recharging that can carry the provider through the rest of the day.
That's so interesting because, you know, I mean, we've all had days like this when you're saying, I can't do, I mean, this is like crazy, I'm going out of my mind. And then you'll see an animal. Isn't that just... And it just
resets
brings
everything.
I love that word, resets, because it resets everything to say, take a breath. This is what's important. Look at this animal is just adoringly looking at you, and you do it resets. So it's almost like maybe we should all just have a dog.
I think so. I mean, I think that is a large part of what's kept me sane in medical school, for sure. And it also being forced to take care of something else, like, forces you to have a certain work-life balance.
Right.
You know, I can't be studying all the time. Even if I wanted to, I couldn't. And so I think that's helped me create a good balance for myself.
You know, that's interesting, Cara, because you have that luxury to have him every day. So that goes my second follow-up here is, you know, I think that all colleges should have therapy dogs. And I was looking at a study from Yale, and they were saying that this is up on the rise. The researchers said that there's over 1,000 animal visitations on campuses. So I think what we're seeing is that there's more and more stress, you know, associated with going to college.
Absolutely.
And also, you know, they're on their own for the first time, and they're away and be homesick, and how these animals can really, really bring down that stress, anxiety level. So, you know, I know here at Boston University we have therapy dogs, but I'm not sure that every campus does. But I think it's something that we should be thinking about. And to tell you the truth, now that you say that, I think every medical school should have one.
Yeah, absolutely. I completely agree. I think that every school, institution, office would benefit from a robust therapy animal program. The one thing I will say, though, is we need to remain mindful of people who are afraid or allergic of dogs.
Sure.
So, for instance, and with that, then create a space where the animal therapy program can be without interfering with those students' lives. So Otis, for instance, doesn't go to the dean's offices because I would never want to be the reason why someone did not seek the help of a dean or seek the help of someone in the Office of Student Affairs because they're afraid or allergic to
That's
dogs.
right. But can't you get allergy dogs that are okay for allergy? They have hair or something versus fur. And
hypoallergenic dogs exist, absolutely. It might just narrow down the pool of animals
that you can do.
Yeah,
you can have here.
Exactly.
And let me tell you, Otis has a lot of fur, so we'll have to vacuum
I'm so sorry.
before he leaves this podcast studio. Put that on the list. Let's get a vacuum.
I'll help.
Are you having trouble sleeping, focusing, or relaxing? If the answer is yes, then the TM Softs White Noise Sleep Sounds podcast has got you covered. This hour-long podcast is made to help you get rid of distractions, reduce stress, relax, and most importantly, get better sleep. You can listen to sounds of nature, white noise, relaxing music, and much, much more. You can check out the TM Softs White Noise Sleep Sounds podcast on Spotify or wherever you listen to your favorite podcast.
So is there any side to having a therapy dog on campus or at a workplace, which is another stressful area?
Right. No, I mean, I think aside from what I mentioned about just making sure it's in a space that doesn't interfere with people who are afraid or allergic to dogs. No, I think that it's a resource that administrators can use to support people going through stressful things. And like you said, jobs are just as stressful as school. And people have, even if the work itself isn't stressful, even if the school itself isn't stressful, stuff outside of those areas can be stressful.
That's right.
And so it's just nice to give people a chance, like an opportunity and a space to kind of find a little bit more joy.
That's right. Now, there are organizations out there, like if someone wants to get, like what I do every semester, where I call up all my therapy dog connections, and there's like a service you can call. You said Bones or something was one of them?
So we get emails from Dog Bones with requests. So I assume that other therapy organizations do it the same way.
Right. And you have them come in for the day or something, because I do this all the time.
Exactly. We get a lot of requests, even just families asking for therapy dogs for their parents who are in
nursing home.
Exactly.
Yes.
Yeah.
Which I think would be huge if what's coming, because they're scared, they're away from home, and I think in that case we might have to do a little lap dog.
Yes, I agree.
Yeah.
Although I will say Otis is the perfect height for sitting next to a wheelchair.
Oh.
He's quite good at that.
I didn't even think about that. You're right. He is the perfect height for that. So there you go. And as long as there's no tennis balls on the bottom of the chair, everything is really good. Cara, tell me, how does Otis change your life?
Yeah, so I would say both dogs have brought just a ton of joy to my life. It's certainly the highlight of my day coming home to them and just being greeted with so much love. They have certainly also brought a lot of fur to my life. That's the one thing I would change, is if I could just keep them from shedding as much as they do. But beyond that, it's only been positive. And then Otis has provided me with more patient interactions, of a different kind. It's so rare to have a patient interaction that's just purely based in joy. And I get to have that with him and the patients, and that's really incredible.
Right.
And then he's also helped me get to know other students, that I might not have known because they're in different classes that I'm in. And he's certainly more popular than I am. It's very common for them to know his name and not my name.
I'm so sorry.
No, that's okay. We do the same thing when we're at the dog park. It's like Cooper's mom or like Scout's dad. That's totally understandable.
Yeah,
but he's just connected me to so many different people.
That's great. And I would imagine, as a doctor, you want to get inside information from the patient, and here you are, you're on a this awful hospital room with this sterile and everything, and you're just not in your environment, so it's so hard to communicate, but he probably just cuts through that layer.
He does. And I think he helps patients trust us as well.
Yeah, and which is great. And then you can really get down to what the problem is.
Absolutely.
Because I know for the students on college here, they are love these dogs. I really don't know how you actually walk him, because I would think once you walk him, there must be like this crowd of people around you that just want to pet him. It takes you an hour to do like a block.
It's hard. It's why I was late actually to this. I apologize. Is that it's hard to go anywhere without being stopped. And I am guilty of that too. When I see another dog, I say hi, even though I have 2 wonderful dogs at home. Like it's hard not to say hi to dogs. And it's great for him. I mean, he loves it. He loves attention. He loves affection, and it's good training for him as well.
And is that because of his breed?
I think so. So he's my first Bernese Mountain Dog, so I don't have a ton of other exposure to other ones, but I know in the research that I did, they are very needy. There's something called the burner lean, like they always want to be pressed up against your body, kind of like he was sitting up against you when we first came in.
I thought it was just me.
Oh, it was extra special for you,
no.
but that is characteristic for their breed. So they just are. They're needy in the most wonderful way.
Great. So what recommendations would you give for anybody that, thinking, gee, I want to get a therapy dog. I think this is a great idea. So what recommendations do you?
Yeah, I mean, I would say just first of all, make sure that you have the time and the resources to take care of a dog. They are a big responsibility. There's a lot of guilt involved with leaving them at the start of the day. And what ends up happening is that you inevitably get a dog walker, and that adds up financially, not to mention the vet bills and all that stuff.
Right.
And Otis eats 5 cups of food a day, so that's also...
Only 5? I find this hard to believe.
Really? Yeah, no, 5.
Okay.
5 cups. But that adds up too.
Yes.
So just make sure that you have all those things prepared before you get a dog.
Right.
Beyond that, I mean, just see what your dog's temperament is like.
Right.
Make sure it's something your dog really likes. If your dog is like my other dog, Ellie, and doesn't like to be cuddled or doesn't like crowds, it might not be the best fit. But if you check off all those boxes, go for it. There's such a need, and it's such a rewarding experience, and it's nice for you, it's nice for the dog.
Right.
A lot of the studies, too, have shown that it actually also lowers dogs' blood pressures.
No kidding.
Yeah, so it's a reciprocal effect.
That's great.
Yeah.
So, see, everyone just needs a little petting and love.
Exactly.
There you go. All right, with that ending, that I feel very much calm now.
Okay.
I want to thank you both for coming.
Thanks for having us.
This is just great. And again, I've done this on campus during exam time, and it's actually the highlight of my semester, because I see how much the students just can relax and release it. This was so interesting to think about. Now they have these therapy dogs that can help you when you're not feeling so great or you're anxious, and they're being trained to help you feel better about yourself. So seek them out. Check your campus or your work site to see if they have a therapy dog program. I can't guarantee that the dog is going to be as cute as Otis that's here in the studio, but check it out. If you want information on how to become a therapy dog mom or dad or something, we'll put that up on the Facebook, Spot On Facebook page too, so you can read up on it with tons and tons of pictures. So with that, I just want to thank you both for coming in.
Thanks for
Spot
having
On.
us. This was fun.
Thanks. Thank you for listening to Spot On. Please subscribe to Spot On your favorite podcast app for new episodes every week. Follow me on Instagram and Twitter at Joan Salge Blake. And also like our Spot On Facebook page and suggest topics for future episodes. And oh, by the way, could you ask 5 of your friends or family members to download Spot On and subscribe to it? Do I ask a lot from you?